Namaskar. I am Dr. S.K. Tamer, consulting neurologist practicing in the city of Durg, Chhattisgarh. Today I am supposed to talk something about epilepsy. The epilepsy is a worldwide problem, so is there in our country too. Once we diagnose a case of epilepsy, we investigate the case of epilepsy, we try to find out the cause of epilepsy, and then we try to manage the epilepsy. And recent years, there has been a lot of improvement in the management of the epilepsy. So one aspect of the epilepsy is the drug monitoring, drug uses in the epilepsy. The second is the surgical epilepsy, surgical treatment of epilepsy. And third, and the most common problem, it is the social management of the epilepsy. Epilepsy child or epilepsy person once there is in the home or in the society, it requires a lot of inputs to maintain a high quality of life in these patients. So there are certain do's and don'ts so far as epilepsy is concerned to make the life of an epileptic a very normal kind of thing. So there are certain do's for the patient and there are certain do's and don'ts for the caregiver. The do's for the patient, once the patient is diagnosed epilepsy and then we start treating the epilepsy, then there are certain do's. The do's number one is to take the medicines regularly. Second, to avoid the alcohol and other recreational drugs which can hamper the quality of management of epilepsy. Third, the epileptic patient should have a normal sleep. At least sleep must be there 6 to 7 or 8 hours sleep is a must. Then they should have a normal healthy diet. Then the exercise regularly is very important in cases of this epilepsy. These epilepsy patients should wear some kind of a badge so that if suddenly a patient gets seizure either in the market or in the movie theater, then the patient, the surrounding person can find out that the person is epilepsy and then he can get a proper treatment or proper first aid. These are some of the do's for the patients. Then there are certain don'ts for the patient. Don't, the patient should never miss a dose of medicine and it should be taken in time and very regularly. If the patient has got comorbidity, then along with the other medication, this medication has to be continued. These patients are not supposed to swim alone. They are not supposed to drive alone. They are not supposed to go to a very adventurous sports. They are not supposed to go in a very high position like certain scuba diving. All these things are don'ts for these patients because they are hazardous thing and then some of them can precipitate. They should avoid the flashing of lights and so that these cases may not get a precipitation of the epilepsy. So these are some of the do's and don'ts. If this is followed very regularly, the quality of life of a patient of epilepsy can be very well. So far as patients is concerned, the caregiver is concerned, especially if it's a child, then there are again certain do's for the parents. The parents should accept the child with epilepsy as a unique person and he should take care of the child. He should not isolate the child. He should not let feel the child that the child has got something different than the other routine, other siblings or other friends besides. So parents should see that what child can do. They should not stress what child cannot do. They should encourage the child. They should reward the child if he does something very good. So these are some of the emotional support, psychological support for the child with epilepsy. The don't for the caregiver is that they should see that the child takes the drug properly. They should not undermine the capability of a child. They should not restrict the child for doing routine work. They should not overprotect the child. Most of these cases, the parents become very overprotective, and the child's ability is severely compromised, hampered. So these are some of the do's and don'ts for the patients as well as for the caregiver. If this is taken care of properly, then the life of a patient with epilepsy can be very good. Thank you so much.